hospital patients. We thought the hospital patients, they are really in very bad condition, and they are going to need a lot of help. And so the last few webinars have been dedicated on the treatment. Actually, we discussed on the treatment of the hospital patients. This time, I'm going to move to another area, which I think is becoming very, very important now, is those people who are in the community who, fortunately, they haven't had the condition at all. They haven't had the COVID-19 infection, and they hope to prevent it, and they do not really want to have it at the moment because of the all the facilities, hospital capacity is full, and it's better not to go for this infection at this time. And for those who have got mild cases, who are also hoping to not to progress to severe lung disease. And I think, and that is very, very important to say at the beginning, prevention always starts from having or practicing healthy lifestyle. So prevention always starts with a healthy lifestyle. And this is I think this is the core of our talk, actually, our conversation tonight. And also, I wanted everybody to make sure that, they understand exactly what they are going to do. Everything it has to be, because I remember, and I had been doing that for so many years, you see, most of the time, you see, when I would like to discuss very detailed medical or scientific, really highly medical scientific issues with patients, I found difficulty because most of my colleagues, they think it's going to confuse the patient. You see, when you give them too much details, it's going to confuse them. And this is why the conventional medicine has just kept the patient like a passive recipient of care. They have just to receive the care, and they have to be told what to do. You see, take these pills and come back and see me in a couple of months' time. But this is not what I wanted to do. I want everybody to understand every little details about what I'm going to say tonight. And then by the time when they apply it, then they would be able to apply it properly. The 5 steps which we are going to talk about tonight is vitamin C, and we have spoken quite a lot about vitamin C in the acute patients. Vitamin D also is very, very important. Zinc, everybody knows zinc is the biggest player in this game. And then we're going to include a couple of lifestyles, moving and hydration. And as a bonus tonight, I'm going to cover issues around these 5 areas in a little bit more details, talking about the healthy lifestyle that everybody should really adopt in these circumstances. And this is the triad, the very important triad, which we are going to discuss: vitamin C, vitamin D, zinc, and zinc. You see, these are the areas which we are going to cover in a little bit more details, and then possibly do the other things, just like, say, a small little, just to complete the picture. Okay, the first step, you need to take vitamin C. And everybody will say, why vitamin C? And where can I find vitamin C? Yes, vitamin C is very important, and we are going to come into that in a minute. The other thing, vitamin C, you can take it as in food, or you can take it as a supplement. Usually the food, the things which I really concentrate on, you see, on my daily basis around the sources of vitamin C in food, I do a lot of bell pepper. Many people, they do kiwi. Kiwi is another very, very important. And citrus, you see, everybody will talk about citrus as rich source of vitamin C. But I think bell pepper and kiwi are probably more bigger sources of vitamin C. Berries is very, very important. And then you can do something like watermelon and pineapple. This is the natural vitamin C. And this is what is called the whole vitamin C, because the whole vitamin C contain number of issues put together to give the effect of vitamin C. If we are going to go for a supplement, then the supplement, the most commonly used supplement is ascorbic acid. And ascorbic acid, fortunately or unfortunately, it is a synthetic product. It is something which has been made mostly out of corn, you see. That is not natural. It is synthetic, but it is good because, as we will see later on, the studies show that it is very effective and it is very well absorbed and there is very high biological availability. But on the other hand, we cannot really make any supplement out of the natural sources of vitamin C, because vitamin C is very, very sensitive. Any heat is going to damage the vitamin C. Even longer period of storage is going to damage the vitamin C content of the fruits and vegetables. And this is why it's better to rely on this ascorbic acid that I think the commonest use. There are some other options as well. The commonest used form of vitamin C. It's a little bit notice here. For those who are diabetic, it's better to keep away from vitamin C sources that has got a lot of sugar. And then we know vitamin C were the big problems in the earlier centuries, in the 15th to the 19th or the 20th century even. You see sailors who goes on sea for a long period of time have been affected by vitamin C deficiency, a condition known as scurvy. And that is a very serious condition. But up to now, on regular basis, I see patients with mild cases of vitamin C deficiency. And this is a picture actually just to show you what is scurvy. Scurvy, it's a disease of the mouth, of the gum, bleeding gum. The gum becomes swollen and spongy and it bleeds. And often you see the patient loses teeth. I have seen many patients with lost teeth. Skin disease, bleeding under the skin. That's another issue of vitamin C. But now I see mild of cases, patients who would come and say, okay, when I brush my teeth, there is a bit of blood coming out of my mouth. And that might be a very, very mild case of vitamin C deficiency. And why vitamin C is important? We know vitamin C is an antioxidant. And we know there are 3 oxidants in our food: vitamin A, vitamin C, and vitamin E. But there are some other antioxidants the body makes, like glutathione. Glutathione, actually, this is the master antioxidant, and it's made up of 3 amino acids put together, which is cysteine, glutamic acid, and glycine. And then there is another very natural antioxidant called SOD, superoxide dismutase 2. And there are 2 of this enzyme inside the cell. One works on the to protect the mitochondria, and the other one works in the cytoplasm. And we will see zinc, which we are going to talk about later on, is the cofactor for SOD2. Why vitamin C is important? Because there is a lot of evidence in the literature showing that vitamin C reduces the duration and severity of seasonal flu. This is why you find so many people, they use these vitamin C containing compounds. You know, normally vitamin C is mixed with other things to reduce the symptoms of the flu. But vitamin C is the major part of these preparations, which we see like Slim Sip, Limsip, and other ones. We see people buying quite a lot during the seasonal, during the winter time. Again, and this is recently, high doses of vitamin C has reduced mortality and length of intensive care unit stay, at least by 3 to 5 days. This is the biggest, there is a big study, it's not a big one, I think it's only 50 patients, done by Dr. Mao in Shanghai, in China. He took 50 patients and he gave them between 10 to 20 grams of vitamin C intravenously. And all these patients survived. None of them died. So the mortality was zero. All of them, they are severe cases. And then they were able to go home at least 3 to 5 days compared to the other patients who have not had vitamin C. So I think that is really, it's not a big study, but it is a good evidence that vitamin C works. And then also vitamin C was observed to go down, and that is really, in a way, just like you drops like a fuel gauge. It's just like a fuel gauge. You see going down while the patient is fighting the infection. That means, you see, the body consumes a lot of vitamin C while the immune system is fighting. That means vitamin C, actually the immune system is using this vitamin C like a fuel to fight the infection. And also over the last few years, I have noticed that many centers in the world, all around the world, are using vitamin C very high doses, you see, over 20, 30, or even 50 grams of vitamin C as a very potent chemotherapeutic agent to treat cancer. Okay, vitamin C is really a magic molecule. I love vitamin C very much. I mean, I have been loving this element, you see, this vitamin C for a long time, because it contributes a lot to various systems in the body. If you can see, for example, vitamin C would determine how is your mood is going to be. So it is like, say, it helped the mood. It also helped the brain function. And when you have got less vitamin C and you're not able to make the neurochemistry of the brain to help your mood, or you're not able to break down this neurochemistry when you do not really want any more of them, then that is another thing, because it has got a lot of action on the brain. It also very important for the metabolism of iron. And as I said previously, I have never seen two very close friends like vitamin C and iron, because vitamin C always helps the absorption of iron, and it helps iron to get incorporated in hemoglobin. Hemoglobin, this is the protein and the heme inside red blood cells, which takes oxygen in the blood from the lung and transfer the oxygen to the various body parts. So that is very important. Vitamin C help your oxygenation of the blood. It also helps anybody to make energy, because you see, if you have got no enough vitamin C, you will not be able to make L-carnitine. And L-carnitine is the stuff which takes fat across the mitochondrial membrane. And when fat is inside the mitochondria, then you will be able to burn fat to make energy. So if you haven't got enough vitamin C, then you might not be able to burn fat, and that is going to be stored in the body. And that might be the underlying cause of obesity and excess weight. Also, vitamin C is very important for the collagen, and just like say the bone health, is also collagen everywhere, in the skin, everywhere. But for me, actually, when I feel like my tendons and my a little bit not working as they should do, a little bit of aches and pains, I know that my vitamin C is low, and I just really top it up with supplements, and often, more often actually, with natural sources of vitamin C. And also wound healing. If you have got good level of vitamin C, wounds will heal much quicker. Vitamin C is also a big support for the adrenal gland. Adrenal gland is a very small, tiny little gland at the top of the kidneys, but it's very important because all the stress hormones are made there. It has got the cortisol, and cortisol, actually the stress hormone, is the nickname of this stress hormone. This stress hormone is glucocorticoid hormone, and glucocorticoid means the hormone that adjusts the blood sugar. So it is very, very important for the adjustment of blood sugar for the sake of the brain, and also important for the immune system because there is something called cortisone, which is the thing which organizes the immune system. And we will see in a minute, you see vitamin C activate and modulate the immune system. Okay, in the immune system, there are two parts of the immune system. There is the innate immune system, which is going to act immediately when something wrong goes into the body. Like say you've got some microbes getting into the body. That is the thing which start acting immediately to defend the body. And this is called the innate system. And the innate system is made up of different types of cells, which is going to kill or to engulf, to eat the invading microbes. And hopefully within few days, like 3 to 5 days, the actual immune system, which is the adaptive immune system, will take over and will run the battle. So the adaptive immune system has got two limbs, T lymphocytes and B lymphocyte. T lymphocyte is the one which is going to carry the cell-mediated immunity. They fight, they get into, they fight the invading microorganisms. And B lymphocyte is the one which is going to make antibodies. And they work together to kill the invading organisms, to clear the rubble, and to clear the mess which is going to happen during the war. And then the antibodies is very interesting because the antibodies are going to tag these cells which contain many of these microbes in order to be attacked by the cell-mediated immunity. So vitamin C works on the innate, that start early, and then it works again on the adaptive immune system, and it activates and it modulates. And modulate means it regulates. It regulates the immune system, because you see the immune system, if it's not going to be regulated, then it might go out of control. And this is the cause behind all of the autoimmune diseases. So there is a study here. Low level of vitamin C resulted in impairment of immunity and high susceptibility to infection and autoimmune disease. And this is exactly what I have explained in this slide. And here we can see practically where vitamin C works. You can see this half on the left side. This is the innate immune system, and you can see vitamin C here help the cells, macrophages and granulocytes to activate these cells to run the phagocytosis. Phagocytosis is like engulfing the invading microorganism. And on the other hand side, the right hand side, you see you have got B and T cells, which is the T cells. And by the way, actually, B and T, T cells is the cells that mature in the thymus, as a small little gland behind the sternum, and the B cells is thought to be mature in the B cells is thought to mature in the gut. So, but you can see vitamin C activate both of them, activate T cell and B cells, activate the cell-mediated immunity and the antibody formation, and that is the real immune system which is going to take over in 3 to 5 days from the entrance of the infective microorganisms. And which type of vitamin C you are going to take? As I said, there is the whole vitamin C that is in fruits and vegetables. As we have given the list of this earlier, this is the best form of vitamin C because this is the natural vitamin C which is going to help everybody. But we have got ascorbic acid, which is the synthetic form of vitamin C available in the market. But the studies has found that this is not too bad, despite the fact it is synthetic and it is made of corn. It is not so bad because it's well absorbed through the gut with a very good bioavailability. And then we have got another one called sodium ascorbate. And this is very good for intravenous injections because you do not really want to inject ascorbic acid because it's too acidic to be injected into the vein. This is why in the hospital we use sodium ascorbate. It's less acidic and is much more tolerated through the vein. And it's also very good for patients who have got stomach problems, acidity, and these things to have sodium ascorbate because the other one, ascorbic acid, is too acidic probably for them. How much vitamin C would you take? Okay, this is exactly what people would like to know. For prevention, and I had been actually in the blog, I had been very conservative about the bigger doses because I do not really like people to depend on pills and tablets and things like that. I would do actually what I advise myself and advise my family is to take the natural food and vegetables which contain vitamin C rather than to take the supplements, which is synthetic stuff. But I have to be a little bit more flexible here because smaller doses might help. But I think if you would like to prevent, you can go for 1 to 5 grams per day, just for prevention. And to prevent progression of the disease, milder form of COVID-19 infection, you do not really want this to progress to a severe form of disease, then I would go for a bigger dose of 2 to 8 grams per day until the patients feel better or the person feel better. And then you can go on a lower dose until full recovery. And at the same time, continue to take food rich in whole vitamin C. And to be honest with you, and this is not available now, to be honest with you, this is better guided by taking a blood level. But I know blood level is not available now. But it's because many people actually, and this is what I have seen in practice, many people have got higher level of vitamin C. Why do you want to give them more of it if they have got a good level of vitamin C that can protect them against the infection and can help them not to progress to the severe form of the infection? So, but if in the normal circumstances, I would really take vitamin C level to see if it is low, then I would top up with the supplement. And then that is going to also to help me to decide on the dose. How much would I'm going to put to give or to prescribe. Again, people should really realize that vitamin C is a water-soluble vitamin, and it's very unlikely for anybody to overdose. It's very unlikely. Okay, that's the first step which we finish. It is vitamin C, and we have seen now what you can take of vitamin C if you are you would like to prevent, or if you would like to prevent progression of the disease. The second step is have adequate vitamin D on board. That is very, very important. Why? Because vitamin C is very common in the UK. I guess the latest statistic is showing more than 90% of the population are insufficient in vitamin D. And again, vitamin D is very important. We know this is because this is everybody, when you talk about vitamin D, oh yes, I know this one because this is the one which is going to prevent osteoporosis. They are talking about the role of vitamin D in calcium because it enhances calcium absorption. and it's very good for bone health. But it's also important for nerve and muscle function. And this is why you see sometimes vitamin D deficiency is just like a statin side effects, because patients with who are having statin, sometimes they feel a lot of pain in muscles and in joints, and that's exactly what they feel, what you feel if you are deficient in vitamin D. Pain everywhere, and is going to get better when you go out in the sun or if you take some supplementations. In the past, rickets now, these are deficiency of vitamin D can result in rickets. I haven't seen any recent cases of rickets in this country, but it's still in some areas in the world. I will show you some pictures for that. In rickets in children, but it causes a condition called osteomalacia in adults. And as you know, osteoporosis is another condition. This is rickets, bowing of the leg. You know, you look at these legs are bowed, you see? And this is what vitamin vitamin D deficiency causes in childhood. In adults, if you can see in this X-ray, there is as if there is a fracture here. This is actually an X-ray of this is the femur, and this is the head of the femur, and this is the neck, and this is the greater tuberosity, and this is the lesser trochanter, you see? And you can see there is a line here which is showing as if there is fracture of the bone here. This is not a fracture. This is what is known as pseudo fracture. This is a false fracture. And it always happens in elderly patients. I mean, many elderly patients, they come with severe pain in the hip, and many people will, oh, he might have had a fall and he has forgotten about it. And this is why now he's coming with this pain. And particularly when they see this picture, this appearance on the X-ray, oh, this is a fracture. So he has to go to the orthopedics. And I think sometimes they are a little bit wiser to do a CT scan or an MRI scan, which is going to reveal that this is not really a fracture. This is just a pseudo fracture. It is very, very painful, and it is one of the common conditions that can happen with vitamin D deficiency. Source of vitamin D. Where do you find vitamin D? Vitamin D is available free of charge if you in the sun. It is free of charge. You see, you just let the sun shine on your skin, and then this is going to make vitamin D for you, free of charge. But unfortunately, people living in high latitudes, like the UK, they are not able to make enough vitamin D during the winter time. This is from November to February. And this is why, for those people, they should really take food rich in vitamin D. And what are the food rich in vitamin D? It is oily fish like salmon, tuna, herrings, mackerel, sardines, egg yolk, beef or liver, cheese, butter also. And many people actually, they say, oh yeah, I can't take butter because you see, I'm allergic to dairy. But butter has got nothing to do with dairy. Butter hasn't got any casein and hasn't got any lactose on it. So yeah, anybody can take butter, and because it contains vitamin D. Mushroom is the one of the few things in plant as plant origin source of vitamin D. Shiitake mushroom is the one which is rich in vitamin D. Again, if you can remember, you see, in the old days, all of us, you see, had cod liver oil as a source of vitamin, not vitamin D only, it also contained vitamin A and vitamin E and omega-3. And as you remember, as when you were a child, or if you are a child now, you see 1 teaspoon of cod liver oil was very, very helpful, you see, to supply you with all these very important vitamins. And vitamin D, when you take vitamin D, you have to activate the vitamin D in a 2 step process, which we are going to say later on. It has to go to the liver to have the one first step of activation, and then it has to go to the kidney for the second step of activation. And you can actually predict, you see, people with liver disease might not be able to run the activation in the liver, and people with kidney disease, like those who are in chronic renal failure, doing dialysis and these things, would not be able to run the activation of vitamin D. And for those patients, they should really have a fully activated vitamin D, because if you give them non-activated, they are not going to do it. Type of vitamin Ds, there are two types. One type is vitamin D2. This is found in plant origin, like mushrooms. It's also found, that's the cheap form, and it's also found in fortified food, because you see, it is, as it's cheap, then it's mixed with food to fortify them, you see, and in supplements as well. The other form of vitamin D is vitamin D3, called cholecalciferol. And this is either you gain it from the sun or from the animal sources, which we mentioned in the previous slide, particularly the oily fish, butter, liver, eggs. Vitamin D2 needs to be activated in the liver to produce 25-hydroxy. This is a chemical structure, 25-hydroxy vitamin D2, which is called calcidol. The other one, vitamin D3, produce, when it's activated in the liver, produce 25-hydroxy calcidol as well. So this is the first step of activation. And calcidol is the type of vitamin D we measure every time when we do a blood test. So when you do a blood test, this is what they measure: 25-hydroxy vitamin D, either D2 or D3, and both of them just show the same on the measurements. When you do the blood test, it will show up exactly the same as in the blood test result. Okay, vitamin D types are not created equal, because vitamin D3 is more effective, because vitamin D3, you know, it comes from the sun and from the animal origin of vitamin D, and it's more effective than vitamin D2 to raise the blood level. So if you are going to buy, I would really advise you to buy vitamin D3, because it can help you more, and it's going to be a little bit more expensive compared to D2. So what does vitamin D do with the immune system? Vitamin D this deficiency is associated, this is a studies actually showed vitamin D deficiency is associated with increased autoimmunity and high susceptibility to infection. So it is very, very important for the immune system. And to be honest with you, the effect of vitamin D is pretty similar to vitamin C. It helps the innate immunity, and it also helps and regulate the actual or adaptive immunity. So it does the same, but the only difference here, there are receptors of vitamin D on the adaptive immune system cells. And this is called T cell and B cells, as we have seen them in the previous slides. T cells and B cells and something called antigen presenting cells. These all have got vitamin D receptors. And what is the importance of these receptors? It makes them all work together as a very well-disciplined one army. That is the importance of vitamin D. It makes the immunity, the adaptive immune system, which is the actual immune system, which will come in, as we said, in 3 to 5 days, which is going to do most of the job, you see, to prevent the body against any invaders, you see. This is going to work all like, say, one discipline. And that is very important, because that is going to protect us from having autoimmune disease. So this is what the immune system, this is what vitamin D do for the immune system. And this is just to show you the picture. On the right-hand side, this is the innate immune system, and the macrophage activity has been accelerated. You can see the dendritic cells. That's a very interesting one. They are macrophages. They eat the microbes as well. They eat the organisms, invading organisms, and then take the information about them and present this information, as you can see the arrow, to the actual immune system, which is the adaptive immune system. They give the information about the invader. This is his antigen, and this is his code, and this is how you can find it, you see. And then according to this information, the adaptive immune system built itself and make T and B cells. And as we said, T is the one which is going to engage with fighting the microorganisms, and B lymphocyte is the ones which is going to make the antibodies, and antibodies is going to make the action of the army very accurate to, because you see the tag, when you tag something, and then the immune system can hit the target with very high precision. And this is just to reduce the casualties, to reduce the friendly fires, you see. So that is very important. And again, you have got the memory cell, which will keep notes of this antigenic structure of the invading organisms, and keep them, you see, in case these invaders come back at any time in the future, then the army would start immediately. They do not really want to wait for 3 to 5 days until they get the information, because next time the information is there, and then they will act immediately. Again, this is the importance of vaccination. When you vaccinate, or when you get the infection, like say measles or chickenpox, then you are not going to get the infections forever because of these memory cells. They keep the information, and then they can act immediately in case if the same invaders, the same microbes come back again. And a little bit difference here between vitamin C and vitamin D, because in vitamin D, there are high risk group who need supplementation anyway. They require supplementation. These are darker skinned people like me, people, African, Afro-Caribbeans, or South Asian. This, because of the dark skin, is not going to allow them to let a lot of ultraviolet light to go through the skin to make vitamin C. So, and we'll see that in a minute, if they're going to use the sunshine as a form of vitamin D, then they have to stay a little bit longer under the sun. Also, people who cover their body for cultural or religious reasons also would need either to eat more forms of vitamin D or to have take supplements. Housebound people who cannot tolerate the sun, such like photosensitivity in lupus patients. They have got photosensitivity. They cannot stand on the sun because it gives them a bit of sensitivity. So these can take vitamin D. Elderly people who cannot go out, particularly those who are living in care homes. And how to improve your vitamin D status? As we said, you can eat food which contain vitamin D, or spend 30 minutes in the sun if you are Caucasian, 30 minutes per day. And actually what I do, advise my patients, is to have 15 minutes in the morning and then another 15 minutes in the afternoon. And that is going to provide them with adequate amount of vitamin D. And at the same time, is going to help their circadian rhythm. You know, the rhythm of sleep and wakefulness. So they are going to make enough melatonin at night, which is going to help them sleep better. So the sun exposure is not only for vitamin D, is going to help their sleep at night as well. By the way, you see, if you if you go out, I mean, to exercise or to stay under the sun for a little while, please do not wash your skin with, do not go straight and have a shower or a bath with the skin and with water and soap. Why? Because vitamin D actually is the greasy layer. You feel it, you see, on your skin when you are under the sun for a little while. It's a greasy layer, and that takes about 24 to 48 hours to be absorbed through the skin. So if you're going to have a shower, just go for, like, say, a shower with water only, no soap to wash out the vitamin D which has already formed on the skin. And as we said, cod liver oil is a very good source of vitamin D, but I think you have to be very careful nowadays and to look for high quality oil, because there is quite a lot of junk on the market. And the dose, also here, I will be a little bit more generous with you compared to the blog. In the blog, actually, I had been also a little bit more careful about putting bigger recommended doses. But actually, this is not my recommendation. This is a recommendation of the Journal of Clinical Endocrinology. And they said it is between 1,000 international unit to 10,000 international unit per day, according to the age. Because you see, children might have less requirements, like say 1,000 unit per day or something like that. But the adult might have a bigger requirement, and depends if they are exposed to the sun, if they are eating well, if they are elderly, if they have got conditions which they would like to prevent, like COVID-19 and things like that. So this is the dose actually, and you can adjust the dose accordingly. To be honest with you, up to nowadays with this pandemic going on, I take 10,000 international unit every day, and that is going to be okay for me until the problem is over. Then I will go back again to my normal dosage. You see, normally you don't have to take vitamin D every day, because this is a fat soluble vitamin. And fat soluble, you see, it's not like water soluble. Water soluble, actually the body will take whatever is needed and the rest will go out in as expensive urine. But here it doesn't go out of the body, it is going to stay there, vitamin D, because it's fat soluble. And normally I advise my patient to take vitamin D with a fatty meal, and the best fatty meal you do in the week or the weekend is Sunday lunch. So it's just like, say, calculate all their weekly requirements and take the dose, just one dose with Sunday lunch. I think that is going to be more helpful to people. Do not take vitamin D with calcium. I have seen so many patients taking Adcal D3 and things like that because it has got calcium and vitamin D. And that recent studies has shown that this combination might cause calcification of blood vessels. And you do not really want to calcification because they lose their flexibility and they can cause vascular disease. So it's better not to take it with calcium. It's better to take vitamin D, and that would be probably okay. And if you're taking vitamin D, then it's good to take vitamin K2 with it. And this is a dose, 180 microgram per day. At the same time, why? Because vitamin D and vitamin K2, they work together. Vitamin D actually put calcium into the bone. This is where we need calcium. And vitamin K2 take calcium from soft tissue and put it into the bone where it's needed. You see, so they work together, increasing the amount of calcium in the bone and taking calcium from soft tissue, which sometimes could be detrimental. And this is vascular calcification. You can see this is the heart, and you can see this is the aorta, and there is a lot of calcification through it, and calcification in the heart circulation. You can see that. And this is also here, there is a lot of calcification along this vessel. It's very, very common. Actually, I see that is particularly in elderly people, you see. And most of these people will have some vascular issues. And nowadays, actually, calcification is, now we do a test called the calcium score. This is to test the cardiovascular system. It is to test the heart vessel, you see, the heart vessels, the heart circulation. It is called the calcium number. And everybody would like to know the number, because you see the number going up, you see, that means the risk of having cardiovascular disease is higher. So this is why it's very, very important to avoid taking too much calcium, because it's going to go on soft tissue, and that is going to be a problem, and it's going to increase your risk for cardiovascular disease. Okay, third step, take a decent dose of zinc. And I think everybody has heard about zinc, and the very important thing, it is a potent antiviral agent. So zinc is just like an antibiotics. It kills viruses. So it is very well needed. It's highly needed in this pandemic. And why? Because it inhibits viral replication. You see, multiplication of viruses, it inhibits that. And I will show you the very important thing about this is there are some substance or agents which are going to be very, very good to put zinc in the right place inside the cell where it is needed. We will see that in the next slide. Sources of zinc: meat, shellfish is a good source. Legumes, chickpeas, lentils, beans. Seeds, pumpkin seed and hemp seed, squash. Nuts, dairy, eggs. These are all very good, rich sources of vitamin of zinc. And the normal dose of vitamin D is around 30 milligrams per day. But in these circumstances, we are having the epidemic and the high risk of everything, then I think you can go for up to 50 or 60 or even 100 milligram of zinc per day. And beware that if you take too much zinc, then it's going to lower the level of copper, because zinc and copper work together. If you are high in zinc, then your copper level will go down. And the opposite is happening. You see, I have got a patient who came with a high risk of infection. Every time she is having infection in the respiratory system, infection in the urinary system, and she is infection every time, every month is having 1 or 2 infections. She took her tonsils and no improvement. And by the time when I checked her, I found her copper level was too high. And this is because she had a bracelet of copper. She was wearing a bracelet of copper for many years. And by the time when she took she removed the bracelet, and she started taking bigger doses of, I gave her bigger doses of zinc, like 100 milligrams of zinc per day. And then her copper comes down and her risk of infection was lowered. Again, as I said, zinc need to be transported inside the cell, and which we are going to see in the next slide. The agents that move zinc inside the cells, as you have heard about them, hydroxychloroquine. This is the drug which is currently used in treatment of acute severe COVID infection, because this takes zinc and put it inside the cell, and it put it actually at the point where the virus multiply, where the virus replicate. You see, and when we stop the replication of the virus, then zinc would kill the virus easily and abort the infection altogether. Again, there are two agents, we are all aware about them, licorice and EGCG in green tea. Actually, EGCG is the active ingredient in green tea. And this is not something new. I think during the 2003 SARS pandemic, there were some reports from that time. They have reported glycyrrhizine, which is the active ingredients in licorice, to increase the intracellular zinc and to enhance the antiviral activity. So this is something which has been discovered at the beginning of the century. But now this information are very, very helpful because we are using them now. And if you can take licorice or food which is rich in licorice, and if you can drink more green tea, that is going to be very helpful in this scenario. But I think for patients who would like to have prevention or would like to have prevention of progress of disease, they might need to have a little bit bigger dose of licorice or green tea. Okay. Okay, I think it's very important here to say something about the progress of disease, because most of the patients who progress to the severe lung disease, these are patients elderly, actually, according to this, that's what they said, over the age of 70, and those with chronic conditions. But as I said in the last webinar, you see, these are not always, this is not always the case, because I have seen younger people in their 30s or 20s, you see, they are very unfit and they are much more at higher risk of having the infection. And I have seen people in their 70s, 80s, or even 90s, they are fit and well, and they are less likely to have the disease. But it is very important here to mention, you see, the importance of having a good cardiopulmonary fitness, because this is going to help you prevent the disease and it's going to help you stay healthy and well. And the cardiopulmonary fitness is divided into two things. One part is having adequate amount of oxygen being transferred through the lung membranes into the blood to oxygenate the blood, and that's one step of it. And this is the lung part. You see, you get the oxygen through the membrane into the blood, and then having a good circulation to get this oxygen to the cells of the body. So you have to have the two together, and if you have the two together, then that means you have got a very good level of cardiopulmonary fitness. How to do that is very simple. You can just do it now, or you can just do it, you see, at any time. It's just like an easy, steady, continuous effort you do for a reasonable duration. And if I'm going to start today, I'm going to start with something like 10, 15 minutes, you see, according to how fit you are. You can start by 10 minutes and aim for 30 minutes in a few weeks' time. Or if you are fit, you can start by 30 minutes and aim for 60 minutes in a few weeks' time. So that is something easy, steady, within your oxygen level. You are not really too, you're not having too much difficulty breathing. You can talk, you can chat with somebody while you are exercising, you are doing this form of exercise. And as I said, this is going to improve your oxygenation of the blood, and is going to improve your distribution of oxygen to the tissue. And as a side effect of this, you're going to have a good mucociliary function. You remember we have spoken about this mucociliary function along the respiratory passages. The mucous membrane produce mucus, which is something which is sticky, and it can help anything entering into the respiratory system. And then there is the ciliary beating all the time to get this stuff, anything which is coming by mistake into your respiratory system, is going to bring it back up to the larynx, which is just down the throat. And then you get what is known as the cough reflex to get these things out of your lung or respiratory system. And the cardiac fitness, I just really want to make it really easy for you to understand. Cardiac fitness, when you exercise, then your circulation becomes more efficient. And if you think of the circulation or the cardiac output, you see, in two ways. The cardiac output is the amount of blood you eject every time the heart beats by the number of the time the heart beats every minute. And if you become healthy and fit and efficient, then the heart does not have to beat fast to contract to get enough blood into the circulation. So the number of heartbeats will become less because the heart is becoming efficient. It every time it contracts, it pushes more blood into the circulation. So it doesn't have to contract so often. So your resting heart rate should come down. And this is what has happened to me. Now, actually, my resting heart rate is around 40 or 42 maximum. This is because my heart is becoming efficient and it pushes blood, you see, forcefully, and it doesn't have to beat too many times. And why the circulation is very important? Why the circulation is very important? Because the circulation is very important to mobilize the immune system from all over the body to the part of the body here, the part is the lung, to fight the infection. And there is some reports, very important reports that comes during this pandemic. It was found that in severe COVID-19 infection makes people have clots in the blood, in the circulation. And these clots is partly contribute to the severe disease in the lung, you see, and also in the kidney. So it causes lung or respiratory failure or lung failure, and it causes kidney failure. So it is because of the clotting in the circulation, which is stopping the blood to go through the blood vessels to be distributed to the rest of the body. So these clots are very, very important. And for this reason, they have adopted a new treatment for that. Every patient with COVID disease, severe COVID disease, is given something called heparin. And heparin is a blood thinning agent. It's given like an injection. And it's a very small, tiny little dose. It's 5,000 units. It's given twice daily to thin up the blood and to stop this clot happening. And that was found to help many patients to recover, particularly patients with severe disease. And so how can I exercise during the lockdown? Many ways to do DIY, gardening, tidying, cleaning the house. Yeah, these are all excellent. We call them non-exercise effort, physical effort. But it's very, very important because you work for a long period of time. You are not really huffing and buffing just like running or whatever. But you are doing some effort, you see, which is going on for a little while. And that is very good. Again, if you are a little bit fit, then you can do running on the spot, squats, push-ups, pull-ups, and lunges. These are all things which you could do. And for those who are saying it's impossible to do while we are in the lockdown, you see, I just gave you one example, Nelson Mandela. He was for 27 years in his 2-to-1 meter cell, and he was able to exercise on daily basis. 27 years, you see. Now we are not going to be for 27 years. We are going to be for probably a few weeks from now, because I think the rate of infection is coming down. I think we probably have reached the epidemic in the UK, and the rate of new cases is coming down. And by the time when it plateaus completely, I'm sure the restriction is going to be eased off a lot. And if you would like to do something, you can go to this youareyourown.gym.com. It can give you some more insight on how to do it. Hydration, we have done that before, and I just really want to do a couple of words on it, you see. Frequent warm fluids, and that is very important to hydrate and to improve the mucociliary function of your respiratory system to get rid of any invaders coming towards the lung. And at the same time, it's going to push the microorganisms into the stomach acidity. And the stomach acids is very acidic, and it's going to kill any organisms going there. Again, you have to avoid dehydrating fluids like alcohol, tea, and coffee, which we are doing too much. And then to adopt, you see, every time you're drinking water. as much as possible. You can do warm drinks of lemon, lime, hibiscus. Hibiscus is very rich in vitamin C as well. And you can do something which is very, very effective here, like citrus tea, which is coming from a tree called Citrus incanus. This is mainly in Greek, and some other areas in the world, and it's available as herbal tea, and it's very good actually to prevent attachment of the virus to the mucous membrane, because you do not want the virus to catch the mucous membrane and to get to gain access to the respiratory system. Propolis is another one. Actually, it's out of the scope of this lecture. It's not like hydration, but it's very, very good to be used as inhaler or spray. And that is going to stop the virus get attachment to the mucous membrane. And propolis is very, very effective treatment for COVID-19 cough. If you give it to somebody with COVID-19, the cough is going to resolve within few minutes. And as we said, licorice and green tea is very important because these two agents are very good to put zinc inside the cell and to stop the virus replication and to stop the infection altogether. And this is my prescription for having a strong immune system. If you are in the community, you are not in the hospital, you are in the community, you haven't had the infection, you want to prevent the infection, you haven't, and you have got probably a mild infection which you want to progress, to prevent progressing to a serious lung disease. Take whole real food, because real food is rich in whole vitamin C, which is the best source of vitamin C, and zinc as well. Regular sun exposure, because the sun will provide you with a lot of vitamin D. So you're getting vitamin D and you're getting vitamin C from just really changing your lifestyle, getting into the sun 15 minutes in the morning, 15 minutes in the evening, and you're done. You have got enough vitamin C to protect you. You can take a little bit more during the epidemic, and that is going to be to help you more. Go to bed 1 hour earlier, and that is very, very important for the immune system. De-stress, and de-stress is very important. Why? Because when you are stressed, your gut function will go down, and you need your gut function. Why the gut function goes down? Because you see, when you are stressed, it's like you are being chased by a lion in the jungle, and you, at that point, you see, you want all the blood and all the resources of the body to go to your brain, to your heart, to your muscle, to fight or flee the danger. Your digestive system is not a priority. So in this case, de-stress and do all what you can do to be less stressed. And that is going to have a positive impact on your gut, and is going to ensure that you're going to benefit from the food you're going to take. Because I have seen so many patients, actually, they eat the best food in the world, but they have got deficiencies, nutritional deficiencies, and serious deficiencies, actually, because the gut is not really working properly. Exercise, breathing exercise, is strengthening your lung further. And actually, what I do here in this context, I do usually the pranayama on regular basis. But I have got many of my my patients. They have done the Wim Hof breathing exercise, and I think you can just check the two on the internet and do the one which you like doing. And in exercise, improve your, as we said, as we have seen, in exercise, improve your cardiopulmonary fitness, your lung function, and your circulation, heart circulation function. And that what you do not want to have during the lockdown, a big tummy like this, because there are a better option like this. Thank you very much indeed. Okay, now I think we will open the platform for some, because I think we have gone over the time, we can open the platform for one question, if that is okay. So any question? Okay.
Hello.
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 Hello. Yes. Have you got a question?
Yeah, I wanted to ask you about zinc and how important is zinc in this COVID-19, and you know, can we take a little bit more?
Of course, yes. Zinc is very, very important because zinc is a very strong antiviral, because we said zinc slow down the replication of the virus, because uh, the viral infection, actually, the most important thing about the viral infection, it's the ability to replicate. And when they replicate, then they take the whole the cell over, completely over. And when so many cells are taken over and the immune system attacking them randomly, this is what causes the lung damage. It causes the pneumonia, and that's what you do not really want to happen. Yes, we have spoken about the thing that is going to present zinc and put it where is needed inside the cell. And these are hydroxychloroquine, licorice, and EGCG, which is in green tea. But you cannot do this unless you have got adequate amount of zinc on board. And as I said, you see, you'd like to prevent, you'd like to stop progression, you better take a bigger dose of zinc every day. Or you can take zinc and copper if you would like, if you don't really want to go through the process of having your zinc high and your copper down, and then you're going to have some problem. You can take zinc and copper in good amounts. But if you're going to do that, a dose of less than 50 is not going to help you. You have to do at least 50 or 60 milligrams of zinc per day, and you might go up to 100 milligrams, because you're going to do it for a couple of weeks. That is not really going to harm the balance between zinc and copper, and that is going to give you the chance of recovering from any infection.
That's great. Thank you, Dr. Sharif.
Okay, thank you very much indeed for your question. Any question, please? Hello? Hello, Eva? Okay.
Vitamin C.
Okay.
Yes, do you hear me?
Yeah, I can hear you. Yes, yeah.
Yes, about vitamin C, you said that it's not really good to take a supplement of vitamin C. So it's enough to take some kiwi, some berries, some. How I know? How can I know if it's enough for vitamin C if I don't take a supplement?
No, I think you can take supplements, but I mean, I said, I mean, start by taking adequate amount of natural vitamin C, which is the whole vitamin C, which contains number of things together to give you the package of benefit of vitamin C. But if you want to do supplements, I think you can do the supplements, and you can take reasonable doses depending on what you are going to prevent. If you want to prevent having the infection, then you go to ascorbic acid 1 to 4 gram per day. Or if you want to progression, you can go for 4 to 8 gram per day. And the studies has shown that ascorbic acid, despite the fact that it is synthetic, but it has got a very, very good bioavailability, very good absorption through the gut, and is very, very good and helpful in these circumstances.
Okay.
Because vitamin C is a water-soluble vitamin, so I don't think you're going to be to have overdose, because the body will take whatever is needed, and the rest will go out in the urine.
Yes, okay, I understand. No, because I misunderstood. I thought that it's not enough. It's not good to take food supplementation with vitamin C. So
No, you can take supplementation.
Is it true that some when I don't know in which country they tried to treat the COVID-19 with injection of vitamin C every day?
Yeah, it is China. It's in China, and I think they're using it now in some parts of the US and in actually some other countries like Italy. Some places are using vitamin C because it has been found, just like say one study done by Dr. Mao in Shanghai in China. He found that, you see, it's very, very helpful because the mortality rate in patients taking vitamin C was 0. There was no deaths among these severe cases of COVID-19, and they were able to go home a little bit earlier than the rest of the patients. So it is very effective in this case. And the other thing about it, you see, which the knowledge we have gained from these studies, also the level of vitamin C goes very, very fast down while the patient is recovering from the infection. That means the immune system is using it like a fuel to fight the infection. So I think it's good to have big doses of vitamin C if you think if anybody thinks that, I mean, they need an extra protection.
Okay. Well, thank you very much. I understand. It's very interesting, really.
Thank you. Thank you very much indeed. Yeah.
The vitamin C that I take, Sharif, is whole cherry extract.
Okay.
Can you hear me?
I can hear you, yes, yeah.
And I don't take plain ascorbic acid. What do you think of that?
What is the content of the whole cherry? Is it the whole? I think this is the whole vitamin C. The whole vitamin C is superior.
Yes.
Is superior. Superior to the.
That's right. That's what I
but
take.
I think they must have prepared it without heat, because if you do any heating for vitamin C, is going to be destroyed completely. So I think they might have done something like drying or whatever, some methodology.
I think so. Yeah.
Huh?
I think they're very good. It's cytoplan.
Yeah, that's very good. Yes,
I think. Yeah. So anyway, that's what I take.
Yeah, that is going to be very helpful because it's going to give you the natural whole vitamin C, which contains many elements on it, in addition to ascorbic acid.
Yeah, and I have so much fruit every day.
Yes, yeah.
It's ridiculous.
Yeah, that's
but how much vitamin? I tend to take vitamin C. I tend to take that when I take my magnesium in the evening, so that the magnesium is more easily absorbed.
Yes. Yeah.
Yeah.
No, I think it's better to take it with food.
Sorry?
It's better to take the vitamins with food because the absorption is much better with food.
Oh, well, as I said, I take it in the evening because that's when I take my magnesium.
Yeah.
Because I take my iron pills in the morning and I take my magnesium at night.
Yeah.
To separate it.
Yeah, but it's good actually because it's not like B vitamins. B vitamins actually is going to probably interfere with your sleep at night, but vitamin C does not. And I think if you're doing some, like say repair and a lot of activities at night, you see, then I think vitamin C at night is not a bad idea. And this is many people, they do like that. They take it in the morning and in the evening, or sometimes they take it 3 or 4 times a day because they don't want to take the full dose. Actually, in America, there is one hospital doing 1,500 milligrams of vitamin C 4 times a day, and it's working very nicely according to their study.
Yeah, the problem is, Sharif, because I'm on Eliquis, apixaban, I know that can be difficult for the kidnees. And so I don't want to overload the kidneys too much.
No, I think you're right here. You're right. You don't want to overload the kidneys, yeah.
Yeah. So, you know,
I'm always worried. Actually, they cause irritation of the bladder as well. A higher dose of vitamin C sometimes causes a bit of irritation. Ascorbic acid causes a bit of irritation of the bladder. Many patients actually, they complain of something like that, yeah.
No, I'm fine with that.
Oh, that's good. That's good.
Dear, oh dear, oh dear.
Okay.
Gosh.
Okay, thank you very much indeed. Yeah, thank you for you all. Yeah, and
thank you very much,
sorry actually for the delay. Actually, it's the internet was down, and then we battled quite a lot with it until we got it.
Dear Ibrahim, do you hear me? I have two little questions too. Do you still hear me?
Oh yes, of course. Yes, yeah, I hear you.
I would like to tell you, first of all, where we can find the vitamin K2. It's where I can find it, because you maybe I think that you advised us to take 180 milligram per day. Where we can find it?
Yeah. Microgram. Yeah.
Vitamin K2. Where
K2,
we can find it?
It's available in the internet. Actually, if you do. In the internet is available, but if you want to have reliable sources, you can. I mean, I do normally a couple of places like the natural dispensary, and but it's available in the internet in good good quality. Actually, it's available in the internet, and you might struggle to find the exact dose of 180 or 200 microgram a day. And sometimes you might be lucky to find the spray one, which you can just put into the under the tongue or in the cheek inside the mouth, and the absorption will be straight away. You don't have to put it through the food and through the gut and something like that, and the absorption might not really be 100%. But it's very available. It's available available everywhere. Yeah.
For me, it's a new. I'm discovering this vitamin because I didn't know much more things about it. But I have another question, because I'm gynecologist, as if you know.
Yes,
it's
yes,
strange
that
to learn this evening that we shouldn't give vitamin D with calcium. In all my life, I was against osteoporosis. I was always prescribing vitamin D with calcium. So we have to separate them. It's a new. It's a very big new for me.
Very new. Actually, I have been giving vitamin D and calcium for long years, actually. But it is just like, say, new research which has come over the last couple of years, which has found that patients who have calcium and vitamin D together, they are likely to have calcification of blood vessels. And from that time, actually, we started hearing about, you see, to assess the heart circulation. Now we are doing this calcium number. You see, the calcium number is becoming a standard test for the coronary disease. But calcium is always available in food in large quantities. Even you see, if you do leafy green stuff is full of calcium. Dairy stuff is full of calcium. So people do not really need to have more calcium unless it is really very, very low. And if it is very low, then you can supplement it separately from vitamin D. I think that's the right thing. But the other thing, also, if you give vitamin D, and that has also some new research which came with this information, that it's better to combine vitamin D with vitamin K2, particularly with people with high risk of cardiovascular disease.
Because this is what I learned today and this evening. Thank you very much.
Oh, thank you very much indeed. Thank you for everybody. Thank you and good night, and see you in the next webinar. Thank you.
Yes.